I didn't get to the D2L, and so I emailed them to you all with some help from a friend. I found a friend, and that happened, and it could happen again. So anyway, autonomic nervous system. Well, that is interesting. You're gonna phone that friend? Yeah, I'm gonna, or flip something off.
It won't let me like download it either. It's saying like there's an issue.
Really?
Like the pictures and stuff won't go down.
Oh, sorry, Macy, you're the only one.
Am I the only one?
Mine work?
So you're running it
I think,
on the internet, that's kind of different.
I think if you can open it in PowerPoint.
You're not
You're not in PowerPoint.
It's working for me. Is it working for you? Is it working for you guys? It's working for me. What's your issue? Now you're married, you're already bitter? You're bossing the wrong lady around. Actually, frankly, you are bossing the right lady around. At home, it's...
I'm not a boss.
Yes. I mean, my first husband. He used to say yes, I said I do, and now I say yes, ma'am. How do you put that really together? Okay, you can see what I can see? The autonomic nervous system. I've referred to it multiple times. I'm going to use a stick. I want to whack. Autonomic nervous systems. Referred to it tons of times throughout the course, of course. But I think to start out, this is a motor system. And I think that it's easy to not think of it that way because it's nervous system running things we don't voluntarily think about, but it's motor. And so you really have two motor systems, the somatic motor division and the autonomic motor division, mainly. There is a little bit of sensory information coming in from autonomic sensory receptors, but we're not even going to talk about that because they run along parallel lines to sensory systems so that there is this kind of diffuse pathway in a sense. But we're really going to only talk about the motor division, which is certainly the main thing for the autonomic nervous system. And so it is innervating all the smooth muscle, all the involuntary things, cardiac muscle, and glands. And so there is dual innervation between the two arms, the sympathetic and parasympathetic divisions, for most things. And that division is to all the viscera, is generally antagonistic. So one is on while the other is off, and conversely so that everything can get run in a homeostatic sense. None of this is separate from what the sensory division and the motor division are doing, that this is trying to operate the viscera intact with what's going on with the internal and external environment. So autonomic is the name for that. And so viscera are the effectors, or the organs for that. And so everything else you think of is sensory in, motor out. This is really the same thing, but it is under the involuntary control. And the effectors are going to be smooth cardiac muscle and glands. So parasympathetic division, this is all just redundant information, but one place here for you, concerned with keeping body energy low. And so that's stuff like digestion, for the most part. The D activities is a good way to look at it: digestion, defecation, and diuresis. Activity is illustrated best by someone who's reading after a meal. So you're digesting, the pupils are constricted so that you can read. So that's just the perfect example, I think, of what is in charge there is parasympathetic division. Gastrointestinal tract activity is high. That just is a good example. Role of the sympathetic division then is for preparedness. You gotta be prepared for any kind of thing that might come up. Exercise, ease, exercise, excitement, which is not spelled correctly, emergency and embarrassment. One of those clearly doesn't work well enough for me, and I'll let you figure out which one. But promoting the adjustments during exercise, so preparedness for activities of all kinds. Or the body under threat, especially threat at night. So if you think of that, someone who is, a perfect example, someone who's threatened, but especially threatened at night. And so that is pupils open, heart rate up, blood pressure up, and fuels activated, so glucose available, so that you can do what you want to do. So skin is cold and sweaty, so you know that about anxiety and that kind of, those sort of reactions. And if you can do that, then all of this other, what happens everywhere begins to make sense. And that is a slide from way back during like cardiology or something that just is another way of showing sympathetic and parasympathetic structures and functions, and you see where it branches off the two arms from the autonomic nervous system. We will look at the effectors for somatic versus autonomic nervous system. Somatic effectors are skeletal muscles. Voluntary, also cerebellar, involuntary sort of fine-tuning of movements that you don't think of. So did you want me just a trip and fall, just a little bit, like just to show what that would look like? You did, but anyway. But all those postural muscles and all that tone, that is involuntary. And so we have a ton of connection between the two, or overlap really of activity. You can't just have one thing without the other. And if you have postural tone, you have to have blood pressure control and stuff like that. So they are working together. ANS effectors, cardiac muscle, smooth muscle, glands, your glands. Except for the places in terms of glands where they also get sort of other endocrine control for them. So if it's nervous control, then it's here. Comparison of somatic and autonomic. Somatic, thick, heavily myelinated neurons. One neuron is leaving the central nervous system. It's a one neuron system, and that's excluding the upper motor neurons that modulate that activity. But there are ganglia within the central nervous system or nearby. That neuron, the cell body is in the spinal cord mostly, or maybe in the brain. But exiting directly to effector, so no ganglion, one neuron. Whereas within the ANS, there is paparazzi. I get that all the time. I'm used to it. No embarrassment here. Two neuron systems, so you have a preganglionic and a postganglionic neuron, and therefore you have a ganglion. So just a collection of cell bodies that is outside the central nervous system. And so preganglionic fibers are myelinated, but sort of thinly so, and postganglionic neurons typically aren't. And so for transmitters, all somatic motor neurons are releasing acetylcholine. So acetylcholine is the thing that's released by the alpha motor neuron at the motor end plate that excites the skeletal muscle. So that's true. Really everything exiting the central nervous system will make use of acetylcholine as its neurotransmitter. But it's where that receptor is and what it is that makes the difference. So all preganglionic fibers from either division are releasing acetylcholine as their neurotransmitter. And then postganglionic neurons from the parasympathetic division will release acetylcholine. From the sympathetic division, norepinephrine, sympathetic norepinephrine. And so here's a little picture of the two. Is that the only place I have that picture? Oh, is that it, Peter? Oh, well, that's it. Yeah, it's just two different pictures that are kind of saying the same thing. So somatic, you have this heavily myelinated single neuron system. This first picture is the parasympathetic. You have a long preganglionic neuron typically before it reaches the ganglion. The sympathetic system will have ganglia very near the spinal cord, and that's what we see on this picture is the sympathetic chain. Okay, you've seen that, you've dissected it. You dissected the sympathetic chain. You didn't get out of that without it. We did. You did. Yeah. What you did did, but that was just you and your love of a cadaver,
I
okay?
came in one night at midnight.
Just kind of got with it. That's you, go girl. So, no, but to the sympathetic chain, so those are ganglia, they're specific to the sympathetic nervous system, and they will be closer to that preganglion, so they're shorter preganglionic axons or neurons. And then we have the adrenal medulla, the special case of the adrenal medulla, which the, like, we've done endocrine, right? And I did it, I'm starting to lose track of what I've done yet and what I haven't done yet. But we did adrenal gland and endocrine, and said that the endocrine gland was really like post-ganglionic cell collection without axons. So anyway, that's why you see that little special sympathetic nerve to the adrenal medulla there. And another example, lightly myelinated, heavily myelinated, widely effectors, and so forth. It's just another of the comparisons. So we leave the somatic nervous system and stick with autonomic nervous system at this time. Higher centers are regulating and coordinating both of these things. As you would suspect, the central nervous system is controlling the outflow from the central nervous system to periphery, be it either the somatic or autonomic divisions. Most adaptations to changing internal and external conditions are involving both skeletal muscle activity and autonomic systems. There's overlap and integration of the two systems. Even though we don't think of it that way, but it's true. It's integrating the internal environment basically to meet the needs of what's going on externally, and being able to switch from the quiet system to the whole crap system, basically. So parasympathetic outflow from the central nervous system is from cranial nerves and from some sacral. There's some nerve outflow from the sacral area of the spinal cord. And so it is often called the craniosacral division, because you love nothing more than having two names for one thing. And so here is parasympathetic. So it's often called craniosacral outflow. And so that segment in between is going to be sympathetic. It's just adorable that it's that way. So sympathetic outflow will be thoracic, basically, the early lumbar. Parasympathetic outflow, cranial sacral. So that's very cute. And cranial outflow, so for all, both parasympathetic or sympathetic, let me say, there is spinal nerve outflow, or somatic motor nerve outflow at every spinal level. And so there's pretty much parasympathetic or sympathetic outflow at every single level, and really just traveling along adjacent spinal nerves. So this isn't necessarily a secondary way. These are fiber optics that are carrying more than one thing along the pathway, and so they are kind of hitching rides with each other. Cranial outflow, then, parasympathetic nerves that are exiting the central nervous system and going to the periphery are following along cranial nerves. And from the sacrum, they're following along splanchnic nerves, which will be specific to the autonomic nervous system. But that would be making a little more sense. So in this picture, you see that these cranial nerves are exiting. They have their own ganglia, which exist for their somatic and sensory functions, but also will carry parasympathetic fibers as well. So let's look at each of the cranial nerves that are also carrying parasympathetic motor nerves. So let me just scan forward to this picture right here. And I've put this up before, and I know you printed it, probably blown it up, probably looking at it a lot, tattoo across your back. It's very cool. But I like these kind of overall pictures because cranial nerves are one of those things you just keep hitting over and over and over and over along the way, because there's sensory in, there's motor out, but you see parasympathetic nerves being carried along, parasympathetic function along with some of them. So here's an overall chart of all the cranial nerves Not all of them have parasympathetic. And what is that, blue? I can't read it right from where I am, but it's blue, blue is the parasympathetic. So that just shows you on one chart, not all the cranial nerves are carrying parasympathetic fibers. So that's an overview thing. But let's go back to each of them, and there are 4. The oculomotor, or cranial nerve number 3, is carrying its motor nerves out, but will carry parasympathetic division nerves via the ciliary ganglion, and then from there to the sphincter of the iris and ciliary muscles. So what would the parasympathetic division be doing to these? You're digesting, you're reading, and so you should be able to have nice accommodated vision and a nice constriction of the pupils. And so that's what you're getting via that route. Facial nerve is carrying parasympathetic fibers, synapsing through various ganglia. Ciliary ganglia will be sending parasympathetic nerves to the lacrimal glands. So these are all smooth muscles and glands that are being served here. Lacrimal glands, what do? They produce this moisture for the eyes. And so those will be contracting and helping to put tears onto the surface of the eye. The sphenopalatine ganglia will then send to nasal glands for secretions, for all the things that make sense, that you're going to be doing. So you need saliva so you can eat, and nasal secretions, just nice quiet breathing, and you have that. So via facial nerve, sphenopalatine ganglia, submandibular ganglia serving salivary glands. So that all makes sense. You need to be able to read and salivate and chew and stuff like that. So we're going to contract the glands that are going to help with those secretions there. And then glossopharyngeal is for parotid salivary glands. So we've hit all the salivary glands. They've made their secretions, help to lubricate the food during eating, and you also have enzymatic activity to break down sugars or carbohydrates into sugars right there in the mouth. And so that all happens. That's parasympathetic division. That makes sense. Cranial outflow via these cranial nerves to get to the effector organ. Most of the parasympathetic outflow, great majority of it, 90%. I put that on there and I took it off and I put it on there because I hate that kind of number like that. But majority of parasympathetic outflow is being carried along the vagus nerve. So remember Ramon and Dale, go vagus for more than one reason? That was true. And so, the vagus is serving a lot of the viscera from heart, lung, liver, digestive tract. And so this is also what we want to understand that the parasympathetic division is going to be controlling as well. So that outflow for that distribution makes a lot of sense. And so, again, via various nerve plexuses serving the neck and thoracic and abdominal cavities. So, what's it doing via the vagus? Where is it going? And we talked about all of these things except gut, because we're doing gut later in a couple of, you do gut. I think it's August, right? I think that's when those lectures are. Anyway, you'll get there. But heart, what was the parasympathetic division wanting to do? Just kind of bring it down. Just keep it going, but at a necessary heart rate to just, keep everything fluid. So via the nodes and fibers, so slowing conduction rate and conduction velocity, reducing heart rate and contractility. My velocity, my TY got cut off there with that picture. Lungs, bronchial smooth muscle contraction. So this is just normal breathing. You're not trying to get more air in than you need. Like if you're trying to really get muscles, like you have a really kind of low oxygen need during rest and digestion, and so it would make sense that you're contracting bronchioles. The opposite will be true for exercise. Then basically, resting or digesting, you need to get all of the digestive enzymes there, all the stuff for liver, lipid emulsification, so gallbladder secretions, also liver secretions, that's what gallbladder secretions are. And pancreatic secretions need to come there, because that's a lot of digestive enzymes. Plus, there's a lot of stuff along the alimentary canal itself. For lubrication, there's mucus secretion, there's gastric acid secretion in the stomach, and there are plenty of small intestine enzymes that are secreted that help move everything along and break all this stuff down for digestion so that it can be absorbed. And so that's really what you're doing with the rest of parasympathetic division from the cranial outflow along the vagus nerve. Makes all kinds of sense, fortunately. Then we have the sacral outflow to get to. And that was just the summary then of all the cranial nerves, so if you want to, and I know you do, just recall. But I think what is something when you first are studying those, you maybe don't really tie in that parasympathetic thing, but there it is. Spinal nerve summary. Okay, so I'm getting to the sacral outflow, and so we just need to know how the spinal nerves exit. And so there's a lot of pictures there, and you saw a good bit about that with Dr. McNeil this morning. That a spinal cord section, you're seeing the gray and white matter, and the dorsal and ventral orientation is very important. And so just to show you, this has all the sympathetic stuff on it. We're in the parasympathetic division, so it functions a little bit differently. But this is dorsal columns of information. Dorsal root is sensory information in. And so there's a dorsal root ganglion, and that was that first order nerve will synapse there for sensory information and be carried in. For reflex activity, you have information for sensory would ascend to, and then, so if you're going up here, so the brain is going to be right about here, right where you are. Well, you're our brain today, see? And so you're sending information then back out via this ventral root, via spinal nerves, somatic nerves out. A reflex would be information directly in, staying at the same level, and information out. So that's how sensory and somatic work. And then for the parasympathetic division, really these cell bodies will just follow along the spinal nerve for distribution for the sacral area. If this is cranial, it doesn't look exactly like that because that cranial nerve is issuing from the brain, pons, medulla, brain and spinal cord. That's where cranial nerves are issuing from. So that's different. But so for spinal, or for sacral nerves, it's going to be looking more like that. So that's just sort of a little, we'll get to the rest of that stuff. The spinal nerves, cranial nerve versus spinal nerve. If it's issuing from the cranium and exiting through openings in the skull, that's a cranial nerve. If it's issuing through openings in the vertebral column, that's a spinal nerve. And so the rest of the parasympathetic division is exiting this through the sacral nerves, originating in lateral gray matter of spinal cord, exiting via the ventral root, branching to form pelvic splanchnic nerves, which pass through inferior hypogastric plexus. So they are being distributed along the spinal nerves that way. So that word splanchnic really just means, it applies to both divisions, parasympathetic and sympathetic, and it really just means a nerve exiting the central nervous system outside of a spinal nerve distribution. So you're applying it to the autonomic nervous system. So a splanchnic nerve is just going to exit and go its own way and have a couple of nerve ganglia or plexuses and then reach their final destination. So the final destination for that is going to be the lower GI tract. Let me see if this next picture has that. Sure it does. Yeah, distal colon, ureter, urinary bladder, and reproductive organs, because remember they all had parasympathetic control. And this is how we're reaching the whole body. Distal colon, sphincters, motility, ureter contractions, urinary bladder, detrusor contraction. relaxes sphincter, being able to urinate. The reproductive organs was vasodilation, the sympathetic was ejaculation. So getting to the kind of pelvic region via the sacral outflow of the parasympathetic division. Sympathetic outflow, right there. So you see the brain and spinal column. You see the thoracic area, and this is from whence all the sympathetic nerves are issuing. And it's really much more diffuse. Parasympathetic division is you reach your ganglion and nearby the effector organ. So it was an otic ganglion or ciliary ganglion or sphenopalatine or hypoglossal or, all these ganglia were near the organ that's being serviced by the parasympathetic division. So those were long pre-ganglionic neurons. And they really just went to where they were and did their effect. So if you look at this, it looks like a lot of lines, and it is, and it tells us that sympathetic outflow is far more diffuse. So the ganglion is closer to the central nervous system, so it's a shorter pre-ganglionic neuron. But that outflow neuron, or post-ganglionic neuron, is going to branch highly. So there's a lot of redundancy of innervation for sympathetic outflow. It's complicated, it's more complex. And, if you looked at that, you would say, well, sympathetic division is going to be doing a lot of cardiovascular control. So sympathetic is really going to be blood vessels, small muscle. Parasympathetic wasn't really doing that so much. So that's one reason it's very diffuse, because it is going to constantly be working to keep blood pressure right as part of its normal function, that tone of blood vessels or vasoconstriction. And the other thing it's doing is then just readiness of the body for threat. So you have to have it be able to fire a lot of special operations at once. And so it just, when you look at this, I hope that you appreciate that that's the role of the sympathetic division, is this readiness, so it looks much more diffuse and complicated and it is than the parasympathetic division. So all S and S, and I'm just putting S and S, and if there is, I just want you to be really careful that you're not reading that as somatic nervous system, because I'm not sure what other abbreviations are being used throughout. So that is really my own name for sympathetic nervous system. So as you're writing stuff, be careful that you're not calling the motor system or somatic system S and S, so you don't get confused. And I put PSNS for parasympathetic. All sympathetic nervous system preganglionic fibers arise from preganglionic cell body and spinal cord segments T1 through about L1-ish. And those start in the IML, that column. And so you have this kind of lateral horn, and it's over here. So you don't see a lateral horn everywhere along all segments, because sympathetic nerve bodies aren't out there in the same place in all the segments. They're really just here. Yes, that's what I would say. Sympathetic outflow. SNS preganglionic fibers exit the spinal cord. SC is just my own abbreviation for spinal cord. I guess you can use it too. Via the ventral root, pass through white Raymi communicans and enter the paravertebral ganglia of the sympathetic trunk. Okay. So apparently Alex is the only one that knows what this is. Thank you. So look, here's the sympathetic trunk or sympathetic chain. It is paravertebral because it's lying close to the vertebra. And so I put paravertebral here, so don't let that freak you out. Some of them will then go on to synapse in prevertebral ganglia, kind of lying in front of the vertebra. But for the most part, every spinal segment will demonstrate a sympathetic ganglion. And so that's not parasympathetic, that's gonna be all sympathetic, so that keeps that clean. And so these rami communicans, or these junctions of fibers that run from the ventral root to the sympathetic chain, these are connections, they're called rami communicans, or a ramus communicantes, for one. With a flourish, ramus communicantes. So anyway, this one here is gray matter, and this one externally is white matter, and you have seen that same distribution of gray and white matter in the spinal cord, where central or closer medial is gray. And then this will, okay, so here we are, cell body, exiting the spinal cord via this ventral root. And if I followed the ventral root on out, we would go out and be distributed along these spinal nerves. But instead, they will communicate via these rami communicans to the sympathetic ganglion, which is paravertebral. There are 3 routes they can take, so that's why it's a little more complicated. So let's get into each of these, shall we? And then out, or via a splanchnic nerve or otherwise. So, it's a little more complicated. Are you with me? You're with me? Okay. 3 possible sympathetic preganglionic pathways. Preganglionic. So where is the ganglion that you have from whence the postganglionic axon issues? These are the ganglion. So the preganglionic nerve fibers will pass to that ganglion with just one group of exceptions. So they either, as the preganglionic sympathetic nerve fiber or axon is exiting the central nervous system, it can just come over here and synapse in its adjacent ganglion. That's just the simple from here to there thing it can do. The other thing, but we know that we're covering the whole body, issuing from only right about here. So you're going to have some ascension and some descension. Really a lot of ascension to other ganglia, so that's the second option. Ascend or descend to a different ganglion. So they'll come out here, and then that's why you have a chain, because you're connecting ganglia, you're connecting spinal levels together, issuing from the sympathetic nervous system. Or the other thing is they can exit the sympathetic chain without synapsing and go synapse somewhere else. Synapse, I don't know why that sounds funny to me today. In another ganglion, or prevertebral ganglion. So we'll look at each of these things separately, and that's one picture showing all the options. So, the first option is just that adjacent ganglion to where it needs to go. And so the preganglionic fiber originates here, cell body here, exits, travels along this ventral root, and how is it getting to the sympathetic chain? Via this gray ramus communicantes. And then just coming here to it and going directly out. Adjacent ganglion. Those will be distributed to sweat glands, erector pili muscles, and also to smooth muscle blood vessel. So there will be a lot of branching post-exit of that postsynaptic nerve to get to those things. So those goosebumps, that's sympathetic. And that's run via this sort of pathway of exiting to the adjacent ganglion. Okay, so a lot of stuff happens with the heart, the lungs, and the eyes in terms of sympathetic system. And so a lot of those have to, a lot of those preganglionic nerves have to ascend. So the cell body original stimulus here, exit via the ventral root, And then we're going here via along the ventral root, coming to the polite ramus communicantes, to the chain, and then ascending to various levels before synapsing, then synapsing. And those will be the ones that serve the head, neck, and lungs. So some of those will descend, but there's a lot of ascension. So you exit in one spot and then have to serve someplace else. How do you get there? This way, via the white communicantes from the ventral root to another ganglion. And the third thing is that can happen, fibers from especially T5 to L1 or 2 to serve kind of lower or pelvic regions will do this. They'll exit via the gray communicantes and exit the whole system without synapsing. And then that becomes a splanchnic nerve because it's leaving the central nervous system before synapsing and then binding another ganglion. And so they're synapsing in a variety of ganglion. They're called prevertebral ganglion. So this is celiac, superior mesenteric, and inferior mesenteric. And so you remember they're named because they're traveling along the arteries. And you remember those branches from the abdominal aorta. So they all have to, nerves are always traveling along something, either other nerves or along, most often along that vein, artery, nerve, kind of little triplet of things that goes along. And so that's where you get those names. There are ganglia at those sites for distribution to the pelvis, the pelvic area mainly, liver, GI tract, kidney, reproductive organs. So that's the third thing. So if it's liver, GI tract, reproductive organs, or bladder, the kidney, the sympathetic nervous system is going along splanchnic nerves to get there. Everything else, you have a synapse in the ganglion, in the paravertebral ganglion. I see a question on your face.
On the pictures, slide 20 and 21, I could just be looking at it wrong. I've been I don't have super great eyes, but it looks like the preganglionics are exiting via the white ramus and then synapsing and coming back through the gray.
You said, oh, for
For
this one?
for the paras. Wait, did I pick the right one? For the sympathetics. Slide 21, it says they exit via the gray communicans.
Like here. Is that it?
Yes. And it
Does it look like it's white?
yeah, it looks like it's
Sure.
going out through the white. No, I'm not sure. That's why I'm
Yeah, I
confused.
can't see that either. But it's generally, yeah, and sometimes, what's in my notes is not right. Oh, yeah, it looks like it's going, does that look like, like down the white, back out through the gray?
Yes.
To the cheek, that may be it. Yes, I guess what I'm thinking is the same thing is accurate, that you're getting to your ganglion via gray.
So overall, it's going to end up exiting.
Well, I don't know, that's that one. Does it look the same on all of them?
Yes.
Okay, on the one that she just was on, there's a picture, and it has like a dot on the gray, and then goes to the white, and then out. Do you see it?
I don't know which one you're talking about.
It's the slide she was on that says,
Here?
yeah, that
Oh,
one.
wait, no, that's, oh, did that have both on it? See, I really can't read that from where I am.
I can zoom in it here for you.
Can I zoom in?
Yeah, it's touchscreen.
We could Google.
Yeah, I can't see that. Yeah, I will just tell you, I don't have specific questions following, are you following gray or white? To be clear, but I guess mainly the main point is that the main point that's important, I think, is that you are accessing the sympathetic chain and ganglion via these communicantes. And that's unique or specific for sympathetic distribution to the nearby ganglia and for the chain. And so, yeah, maybe I have something written wrong, or we're not reading that. That's not super specific for me to tell you. That I don't know. I'm not sure now, I'm confused. But I do know that really the main thing in there is to understand this communication via this root and getting to the trunk for synapse in the local or adjacent, ascending ganglion, whether you're following right or white communicator. I feel like what I've written there is accurate, but then I've also done that before where it wasn't. So I always believe that what I write is on the slide is true, but it isn't always. So if that sounds confusing, then it is. Fair enough. Oh, okay. I'm seeing the word preganglion and I'm reading parasympathetic, so now I'm really confused. Okay, so we can exit the spinal cord and get to an adjacent ganglion. We can exit the spinal cord and get to a different ganglion, or we can exit for synapsing, or we can exit the spinal cord and get, without synapsing, that's then called a splanchnic nerve, traveling to a ganglion outside of that area and synapsing. In those cases, those are longer preganglionic synapses or nerves. So I think the main thing to note is you have parasympathetic is trying to get its information to effectors, and that information is exiting along cranial nerves or along some sacral splanchnics and getting to its target. Or the sympathetic is using this additional sympathetic chain and ganglia, because what you're really trying to do is create a diffuse array of being able to reach effector targets. And that's mainly the big thing to note. And I want you to understand when you're hearing about the sympathetic chain that it is right there along the spinal cord. The ganglia are where synapses are occurring, with the exception of splanchnic nerves. And that the autonomic nervous system is a two-neuron system, which is pre and post. And so what it is anatomically is one thing, and then what it does is the other. And this is a picture where we're seeing, this is all the outflows then, so you can see it on your whole screen. But there is a lot of overlap of activity. So like Dr. McNeil was talking about those dermatomes, that sensory information, there's a lot of overlap, and so you don't have a lot of accuracy sometimes with that sensory information for the trunk. It's kind of like that you have all this overlap, so those organs are being told what to do or what not to do very precisely and in a kind of a big way, a big powerful way, which is necessary for the function of the sympathetic nervous system. So that all looks very complicated, but if you looked at all of the bits, you'll see that it's all the things we've really been talking about all along throughout the whole course. And then here's everything. So sympathetic outflow on this side, on the left, and parasympathetic on the right, and you see that you have this meeting of this dual innervation of most of the viscera and an antagonistic system of activity between the two. One is off and one is on. Specific, and then you have blood vessels are specific to the central nervous system as well. And so the whole spinal cord is made use of for outflow, basically, which makes sense. And if you can see all the sensory input, it would look complicated like that. All the motor output, the somatic, it would look very branched like that to reach the whole body from this centralized location. And there's another one without pictures of organs on it, if that does it for you. Okay, so I want to talk about the actual neurotransmitters involved, if you want to take a little breaky break, do that. But I want to start back in just about 7 minutes, because I want to get done a little bit early. I'm going to a funeral day. I have a cousin that committed suicide, so the second one in 5 months, so that's, I'm going to get out here and go to that today. Yeah. Anyway, let's get back about